first, do no harm. Those are words that are famously attributed to the Hippocratic Oath, an oath that doctors have taken for centuries. But would it surprise you that I did not take the Hippocratic Oath? I did not take the Hippocratic Oath. I did not say those 4 words, first, do no harm. But it's important to understand a little bit more about the oath. The oath originated with Hippocrates. Hippocrates was a Greek physician working around 400 BC, and many people would consider him to be the father of medicine. Among many of Hippocrates' contributions was the idea that physicians should have a strong ethic. And he believed that doctors should take an oath to that ethos before they begin the practice of medicine. And the value of an oath has remained even to today. But the Hippocratic Oath itself is a strange thing. It begins by saying, I swear to Apollo and Hygeia. It talks about taking care of your teachers financially if they're in need. It talks about not performing abortions. It even talks about not performing surgery at all. Overall, the Hippocratic Oath is a complete mess. And here's the kicker. In its original form, the Hippocratic Oath doesn't even say those words, first, do no harm. Those words were actually attributed to some of Hippocrates' additional writings. The reality is that many of the principles and ethics in the Hippocratic Oath fail to represent the values of our society today. For example, in Canada, we have medical assistance in dying. This is an important societal norm that really would fall outside of the original Hippocratic Oath. It wouldn't be possible if doctors followed that oath to its T. But one thing that hasn't changed is the value of taking a public oath. And although I said I didn't take the Hippocratic Oath, there was an oath that I took at my school, McMaster University, many years ago. Most medical schools to this day do believe in the value of saying a public oath, of having that public expression of a medical ethos. But where that oath comes from is completely different. Many medical schools have the students themselves pick an oath or maybe even write the oath each year fresh to reflect the values of that class. Other schools have chosen a specific oath that represents the school's values, and that oath is said by students every year. But regardless, in 2022 and 2023, medical schools have updated the oath to reflect the values of society today and the values of their students in their school, which I think is really important. But let's talk about that concept of first, do no harm, really what this video is about. Despite its questionable roots, many people think actually doctors say those 4 words, first I'll do no harm. And those 4 words actually do liken an important principle of medicine, the principle of non-maleficence. And it also is partially related to a separate principle, the idea of beneficence. And I'm going to talk about them a bit more here. So the concept of non-maleficence is exactly that. First, do no harm. Make sure your actions are not harmful to individuals. And of course, beneficence is this idea that what you're doing should help people. And really, those 2 principles are the cornerstone of practicing medicine. But believe it or not, the idea of non-maleficence and beneficence actually come into conflict all the time. A surgeon, by definition, causes some harm. I think this is why Hippocrates actually had it in his original oath not to provide surgical care, because the concept is that surgery itself injures tissues first. Before you can help a patient with surgery, you have to cut the skin, you have to yield the knife, you have to injure the patient in order to heal. And that in and of itself is harm. But our goal obviously is to provide additional help to the patient. I think about this very often in a large operation. When I've done a major surgery or I'm in the middle of the operation, there's a certain point where that if you stop the operation and you didn't do anything else, the patient would inevitably die. Their abdomen's open, there's a clamp on a blood vessel, there's some important thing done. You have to carry that operation through to its conclusion. There is a point where clearly there's been more harm done to the patient than the benefit. And we cross that Rubicon, we cross that threshold multiple times when we're doing a major operation. And so the idea of avoiding harm at all costs is really the opposite of what you should be thinking of when you're a surgeon. So a surgeon truly does harm first, but with the idea that it's going to help and benefit the patient. So I think the concept for doctors is not actually the idea of doing no harm. It's the idea to minimize harm and maximize benefit. We know there's risks to any medication we do, any procedure we do, any operation we do. There always is the chance for harm, but the goal is to help. The patient comes with a need, they come with a problem, and our job is to solve it. So a medical ethic is very important, where we believe that we should benefit patients in everything that we do. But the concept of first do no harm is both outdated and impractical to the actual practice of medicine. My name is Dr. Rich Hilsden. You've been watching my channel, Knife Skills. Thank you for sticking around to the end. If you like this video, you'd be really interested in watching one of the videos I have down below, particularly the one on error, because even in the best practice of medicine, errors do occur. Once again, thank you and have a great day.